get so many questions about anesthesia. So first off, what are the different types of anesthesia?
There are a few types of anesthesia that we offer at Brooks Oral Surgery to help keep you comfortable during your procedure. The first and simplest type is local anesthesia, where we essentially numb the area where we're going to be working so that you don't feel anything that's sharp or uncomfortable during the course of the procedure. Secondly, we offer nitrous oxide sedation, which is also known as laughing gas, which helps to keep you comfortable, maybe take the edge off of your anesthetic and of your anxieties and calm you a little bit during the course of the procedure. Of course, you're awake for this, but we augment with local anesthesia as well to keep you numb and not feeling anything uncomfortable. The additional types of anesthesia that we offer are IV sedation, in which we would start an IV line that helps to give you some medication that can calm you even more, sometimes even getting you off into a twilight or sleepy state. And then general anesthesia as well, which will fully put you to sleep, during which you're being fully monitored and observed to make sure that everything is nice and safe. This way, you're the most comfortable that you can be during the course of your procedure.
And are oral surgeons trained to administer these types of anesthesia?
We are trained to deliver these types of anesthesia, of course, and that training continues on into the entire length of our career with continuing education. It all starts in our residency programs, during which we rotate with the anesthesia department and function as though we're their residents and their doctors as well, maintaining and delivering anesthesia to patients in the operating room setting, as well as to pediatric patients in their operating room setting as well.
Wow, that's a lot of training.
Oh, it is, certainly. And even when we're not rotating with the anesthesia department, because deliverance of anesthesia is such an important part of our training and our surgery and what we do on a daily basis, we continue to deliver anesthesia throughout our training and our patients in the private practice and in the oral surgery residency clinics during our training programs.
So how do I choose what type of anesthesia is right for me or my kiddo or my loved one?
That's a great question. Everybody's anesthetic experience should be tailored to them. There is no cookie cutter version of way to approach the delivery of anesthesia to every individual patient. This is why we have consultations for the overwhelming majority of our appointments. It gives you an opportunity to sit down with your surgeon, formulate a surgical treatment plan, and determine what type of anesthetic would be most appropriate for your procedure. If local anesthesia would be just simple enough to carry out your procedure in a very easy, locally anesthetized way, then that might be great. However, certain procedures do call for higher levels of anesthesia, and having an individual consultation and the ability to ask questions and direct your care in the way that you see fit is typically the best way to approach it.
And is this safe?
Deliverance of anesthesia in an outpatient setting is incredibly safe. It starts with our training, carries through with continuing education, moves on to all of the processes and systems that we have in place here. We continually train ourselves and our team to create an environment where we can deliver a safe and predictable anesthetic. Patient selection is a big part of that. That's why we have consultations for the overwhelming majority of our appointments in order to identify and potentially prevent any type of emergency that could come up during the course of treatment. In the event that there is an emergency, we can rely on the countless hours of training and re-updating that we perform both with ourselves, our team, and our facilities to ensure that a safe anesthetic can be delivered, and that in the event of an emergency, we're able to provide the appropriate level of treatment and care for our patient.
Is there pain that comes along with anesthesia?
That's a great question. Pain is certainly something that we encounter on a regular basis. Most of the time, it's what initiates the fear of coming to see us to begin with. To a degree, there is a little bit of discomfort involved with any anesthetic. Of course, the injection of local anesthesia does have some discomfort that's associated with it, but the attempt is to try and minimize that as much as possible. Encountering an IV sedation or a general anesthetic certainly helps to mitigate that even further, reducing the pain to almost nothing to allow for a very comfortable surgical experience.
And Dr. Zimberg, are there potential side effects that I should be concerned about?
There are side effects that can happen with anesthesia. Certainly the more medications we use does increase the number of potential side effects that can occur. The most common side effects that happen with anesthesia are maybe a little bit of forgetfulness or feeling a little off or goofy for a few hours after the procedure, which is normal, and which is why we have protocols to help protect against those types of issues after surgery. We typically recommend that you go home. You're going to have someone who's going to be driving you home from your procedure, and they're there to take care of you and make sure that you're safe in the post-anesthetic period. The other types of reactions that can happen, also common, relatively common, is post-operative nausea and vomiting, for which if we know about it in the forefront, we can help to prevent those types of occurrences happening afterwards. Certainly medications and additional treatments can be rendered in the event that you do have a type of reaction like this. Other reactions to anesthesia are rare, and the overwhelming majority of them can be managed in the event that they occur.
And when I'm planning to have anesthesia, how should I prepare for my appointment?
Certainly being prepared on the day of the surgery is very important. First and foremost, it's critical that you don't have anything to eat or drink for 8 hours prior to the procedure. There are certain alterations to that plan that can be discussed with your doctor during your consultation visit. The second part of that is that you have to have a chaperone, someone over the age of 18, to drive you home and care for you after the anesthetic. It is possible that you could be a little off after your anesthetic due to the medications, and so we want to make sure that you're safe in the post-anesthetic period. Certain medications are important to take on the day of surgery, and certain medications are important not to take. It's important that you ask this question of your surgeon prior to your procedure.
Thanks so much, Dr. Zimberg. That was really interesting and super informative.
Hey, happy to do it. Thank you.